My name is Ronald Grossman. I'm a professor of medicine at the University of Toronto. I'm a practicing respirologist, and I have a long-standing interest in the management and prevention of respiratory tract infections. RSV stands for Respiratory Syncytial virus. So the question is, where does the name syncytium come from? And the answer is when the virus attacks the air tubes of the lung, the cells that line the airway get damaged. They are shed from the surface of these air tubes, and when they clump together, they form a compound called a syncytium, which is where the name comes from. This is important because these clumps of cells block air tubes and affect the ability to breathe. RSV is a typical respiratory virus. Most of these viruses spread by what are called droplet nuclei. When patients or individuals talk, cough, or sneeze, they produce very small particles, and the viruses are in these particles. This is important because individuals who are in contact with people who are infected, who are coughing, sneezing, and talking, they can be exposed to these particles that are generated by the people who are infected, and then they in turn become infected. RSV is a very contagious virus. It often spreads within families. So someone comes into the family home with a virus, and because they're producing these small droplet nuclei, other members of the family are in close contact with them. They inhale these particles, and they in turn get infected. So it's very commonly spread within families. So when someone is infected with RSV, there's usually an incubation period of about 4 or 4.5 days. That last day, the third or fourth day, individuals can have no symptoms but can spread the infection. So one of the problems with this is someone could be infected, not know it, and give it to other family members. Once someone is ill with the virus, that is, they're symptomatic, they tend to spread virus for about 4 or 5 days. Older individuals tend to spread the virus longer because the body has a problem getting rid of the virus, because as one gets older, the immune system weakens, so the virus hangs around for a little bit longer. Individuals who are immunocompromised, these people who have a very weakened immune system, either because of some underlying disease like cancer, or they're on medications that suppress their immune system, will shed virus for longer periods of time, maybe up to several weeks, in which case the virus can be spread to other family members for longer periods of time. RSV causes a typical respiratory infection, sometimes a low-grade fever, cough, a runny nose, sore throat, aches and pains. Typical symptoms of a viral infection, not terribly dissimilar from influenza or any of the other respiratory viruses. The only thing that's a bit different about RSV compared to others is that because RSV produces these clumps of cells which block air tubes, it can sometimes lead to wheezing. So COVID, RSV, influenza are all respiratory viruses that can cause damage to the lung. They produce syndromes that are very similar to each other, typical symptoms such as cough and sore throat and shortness of breath. Each of them in turn have their own way of damaging the lung. Influenza and COVID often damage the lung itself, whereas RSV tends to damage just the lining of the air tubes of the lung, not the lung itself. But clinically, when we're trying to identify one virus versus another, we cannot. The clinical syndromes are very similar to each other. It's almost impossible to differentiate one virus from another. The way to detect whether someone has a positive infection from RSV is to actually examine secretions from that individual, whether it's a swab of the back of the nose or swab of the back of the throat, or looking at material that the individual coughs up, and do a test where you're looking for the DNA of the virus. So we have these diagnostic tests that are generally done in a hospital setting to identify whether someone has RSV. The tests they're called multiplex PCR tests, and they can simultaneously look for RSV, they can look for COVID, and they look for influenza all in one test, and we can separate them using that test. There are no real home tests to diagnose RSV. Anyone can contract an infection with RSV because it spreads from individual to individual. So if you're exposed to someone who's infected and you inhale some of these little droplets that individuals who are infected produce, you can get infection too. But it's quite clear that people who have either an immature immune system, the very young, or someone who has a waning immune system, the very old, are more susceptible. Many individuals who have other health problems also are at increased risk for not only infection with the virus, but also having complications from the virus. So individuals with underlying lung disease, because the lung is weakened from this underlying lung disease, they're more likely to be infected with the virus. People with underlying heart disease are at higher risk. Diabetics, people who are on medication that impair their immune system, whether it's for a rheumatologic disorder or a skin disorder, anything that affects the immune system can make an individual more likely to be infected. On top of that, those individuals who are more likely to get the disorder are also more likely to get severe complications from the disorder. So at the end of the day, not getting infected is the best route you can take. So people with underlying lung diseases are more susceptible to infection with any respiratory virus. So the sorts of conditions that are often associated with increased risk include asthma, chronic obstructive lung disease, a disease related to cigarette smoking, but other lung diseases such as bronchiectasis, pulmonary fibrosis, many lung disorders are associated with increased risk. All of these lung diseases basically together have as a major risk factor the lung itself is damaged. And when the lung is damaged, it is more likely to be infected with a virus than if a lung is not damaged. So virtually any underlying lung disease will increase the risk of infection with RSV. So RSV spreads amongst family members, generally speaking, and individuals who are older are at particular risk because as one gets older, the immune system of that individual progressively gets weaker and weaker. That's a concept called immune senescence. It happens to everybody, and as one gets older and older, your immune system gets weaker and weaker. Accordingly, older individuals are at increased risk of getting infected with any respiratory virus, including RSV, but maybe more importantly, they're at risk of developing severe disease from these infectious agents, such that they end up in hospital with complications of that infection with really bad outcomes possible. If someone is older, they get infected with RSV and they get hospitalized, so that's severe RSV infection, many things can change. Many people after several months of recovery are never back to their baseline. They're less functional 6 months later. About 1 in 3 will be less functional at the end of 6 months compared to what they were able to do prior to the hospitalization. What does that mean? So an individual who was capable of doing their own shopping all of a sudden can't do that anymore, and they become weaker, more debilitated, and it affects their quality of life. About 1 in 10 who gets hospitalized with RSV and survives the infection will lose their ability to be independent. That means, again, moving from the ability to do your own shopping, all of a sudden these individuals will need help just to get by. They need someone to help them with dressing, with feeding, looking after their apartment. And some of these individuals end up in a nursing home because they can't look after themselves anymore. This is one of the really bad outcomes that can occur in the elderly who get hospitalized with RSV infection. So individuals who survive hospitalization with this RSV infection, many of them, because they're not as functional as they were before, can become depressed. Their whole quality of life changes, and that has a really bad outcome in terms of how people can tolerate their quality of life. So having one of these respiratory infections and being debilitated associated with it can really be a problem, particularly with respect to depression. There is no known active treatment for RSV infection. So if someone is infected with RSV, the obligation is on that individual to try and stop the propagation of this virus to other members of their family or other people that they get to come in contact with, particularly at work. So if someone is sick with RSV, don't go to work. Stay home so you won't infect other people. If you are infected with RSV, cover your mouth and nose when you cough or sneeze. You may want to wear a mask to reduce the likelihood of spreading infection to other people. But fundamentally, it's basic hygiene measures. Wash your hands, wear a mask, don't go to work. Those are the simple things that help prevent the spread of this infection to other vulnerable people. The best way someone can learn about RSV is to speak to their own family doctor, who has a wealth of knowledge about this virus and its potential complications.